Oh my God, we're opening a can of worms today. We've been talking about surgical terms and trying to clarify the difference between ablation and vaporization versus the below the power density, coagulation, fulguration, cauterization, burning surgery. So the problem is all the time. I mean, I have a couple records from patients I've reviewed over the last 2 days of where they say laparoscopy with ablation of endometriosis, and then down in the report where you read it, what did they actually do? Powder burn lesions below the right uterosacral ligament were ablated with the argon beam coagulator. ABC, argon beam coagulator. It's not the ABA, argon beam ablator. So they're coagulating and they're saying they're ablating. Another one, laparoscopy with ablation of endometriosis. And basically using the Cleppinger forceps, the areas of endometriosis were ablated. No, that's not what happened. You know, the Cleppinger forceps are very old, very archaic, big spatulas, what we used to use to ligate, to tie tubes. You put the tissue between it, it burns the tissue between it. It's very large, it's very imprecise. No, time to get rid of it. Don't do it, don't go there. So the problem is, really, if we rephrase this, there's spot treatment of endometriosis and there's wide excision of endometriosis. Now, most of the spot treatment is done with coagulation. So we have two problems with that. You're not removing all the disease, you're not treating it all, and the areas that you're treating is imprecise. So we're burning the tissue, getting some of the disease, not all of it, and then burning normal tissue that we don't want to hurt. Okay, so, and then if we truly do vaporize or ablate, you can't use that as the primary tool because you're spot treating. Even if you vaporized the different areas, we're leaving all this stuff behind because, again, the process of endometriosis is scattered, you know, and there's areas that are big and easy to see, there's smaller areas that not. You have to get around all of it and do wide excision. So we cannot burn it, you cannot spot treat it, you have to do wide excision. So again, it's very prevalent out there. I had ablation surgery. You probably didn't, okay? It was coagulation or burning surgery. So I want to set the record straight. Really, coagulation, burning surgery, spot treatment versus wide excision. That's the critical concept. And we'll take one other pass at this as far as there was a question about, you know, is it okay to ablate endometriosis on my ovary or do I need wide excision? Well, again, is this the first time you've been pregnant? Well, I'm a male, I've never been pregnant, so I can't say yes or no. Both answers are wrong. And so let's be accurate in how we're using words to describe what's occurring, and then we can all be on the same page and relate accurately what's happening and what's not. So again, the term ablation surgery, I advocate we eliminate that as a reference because as you go through op reports when they're saying ablation of surgery, your surgeon doesn't know what they're talking about. They're using the wrong words. So again, I'm a nitpicker, but we got to be accurate in what we're describing. Let's move forward all talking about the same thing and with correct information. And it all falls into place after that. All righty, y'all have a good day.